Hello everyone, I'm Dr. Karan Shetty. I'm a board-certified plastic surgeon from Bangalore, India. Today we're going to be talking about anabolic steroids. This is something which a lot of our patients ask, and usually they come to us with a gynecomastia. So our topic today is to discuss, does the use of anabolic steroids cause gynecomastia in bodybuilders or in anyone who is lifting weights? So what is gynecomastia? Gynecomastia is a condition that increases the size in the male breast. This happens due to an imbalance in two hormones in the body, that is testosterone and estrogen. Usually during puberty there is a imbalance in the two hormones, which is why during puberty adolescent boys can develop gynecomastia, or in older men because of the decrease in testosterone men over 50 can develop gynecomastia. What happens when you take anabolic steroids in an age group where you shouldn't develop gynecomastia? While this can be embarrassing, like I said, for older people and for adolescents, for bodybuilders or for people who are actively, competitively working out, it can be career ending because these sports are competitive events. The contestants boast of single-digit percentages of fat, which makes the glandular tissue that they have even more pronounced. Most of the time bodybuilders don't have a sound medical knowledge about understanding the negative effects of anabolic steroids, and most of them either read on the internet or they have friends or colleagues who help them out with, or their trainers mainly, who help them out with anabolic steroids. And most of these guys who are giving them the anabolic steroids themselves don't have an understanding about what is going to happen to the body, which is why then it contributes to their insecurities and low self-esteem. So what happens when we take steroids in our body? When you take steroids, the steroid itself gets converted into estrogen in the body. This increase in estrogen in the body can cause to develop unwanted breast fat. Male bodybuilders, as you know, are very body conscious, and due to the competitive standards of the sport, this limits their growth in their particular field. While most people do their research on the pros and cons of anabolic steroids, they don't necessarily understand the implications of steroids and how to use it correctly. So because the steroid itself gets converted into estrogen, there's gland, a breast tissue which is developed. So what happens is this breast tissue which is developed is not amenable to exercise, and which is why this glandular tissue cannot be reduced by exercise.
This is the amount of gland that we have taken out of a person who had cycles of steroids for bodybuilding. This is the amount of gland that we had to remove. This is all breast tissue. This is the amount of gland that we had to remove. It's a huge amount. So the amount of gland that is created as a result of steroid-induced gynecomastia in bodybuilders is huge. So it's almost like a big ball of gland.
So the question is, will gynecomastia go away once you stop taking your steroid? Another misunderstanding that bodybuilders have, or in the bodybuilding community, is the belief that if you developed enlarged male breasts while taking steroids, it will simply go away once you stop taking them. This is absolutely not true. The breast tissue which has developed from using steroids will not go away. It is permanent. The dieting or increasing chest workouts will also not fix the problem. The only way to correct this, or the only solution for this, is a gynecomastia surgery. How does gynecomastia seen in bodybuilders? Usually it can be seen as a combination of classic gynecomastia, it can be seen as puffy nipples, or even sometimes enlarged areolas. So how can you correct it? It is, like I said, steroid-induced gynecomastia is extremely glandular, which means it has a lot of breast tissue. So it is important. It is very difficult to provide a very desirable result only with liposuction. Usually, it's a combination of liposculpture with surgical excision of the gland itself, which gives the best possible outcome, and this is done via gynecomastia surgery. So, irrespective of anything you hear anywhere, this is the only scientific basis for how it occurs and how it can be treated. Thank you. I hope this has helped you in understanding how the use of anabolic steroids in bodybuilders is seen. Thank you.